All right, welcome back to ABA exam review and the continuation of our BCBA 5th edition task list series. We're continuing H with H3, recommend intervention goals based on factors like client preferences, supporting environments, risk constraints, and social validity. Now, we've covered each of these individually. You know what client preferences are and how to find them, what environments mean, stakeholders, risk, ethics, constraints, and social validity. We know which each of these things are individually. Now we're just going to take those and apply them to interventions. So H3, again, is not all that difficult, and we're just going to boil it down to the essence of what you want to know for your exam. As always, please like and subscribe. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. So let's start with this. Data is our guide, right? We did H2, assessment, science, results. That's what we base interventions on and what we're doing. We have to use data. But we can't neglect what the client wants, what the client needs, and our ethical commitment to that client. And so they have to be part of what we're doing. We can't just order them around, boss them around, tell them where to go, what to do at all times. They need to feel like they're involved. With that said, client preference is not necessarily the most important factor. Just like when we get stakeholders, let's say parents involved, they can't have the final say in everything because you're the expert, you're the analyst, but they have to be part of the team. And when you get the client involved and you ask their opinion, you motivate them, you get them engaged, and you're going to see more success. So again, you're going to be dealing with clients of different ages and different developmental levels, and you can't neglect them just because maybe you feel what you're doing they don't understand or it's too high level. There's got to be a way you can get them involved because it's ultimately their treatment. It's their life that we are working to improve in a lot of cases. Now, the environment, which includes those around the client, stakeholders, where they live, where they go to school, where they work, you have to ask yourself, will that intervention be successful in that environment? Is it sustainable? You have to think about if you're in a clinic setting, what do you have available at your clinic? What don't you have available? What is going to restrict you from being able to do all the things you want? If you're in the home setting, same questions. We can all write amazing interventions, but if we don't have an environment that is conducive to implementing that intervention, it's not going to be successful. So data and assessment results drive our interventions, but these items cannot be neglected, right? We can't neglect client preference. We can't neglect what the environment is giving us. It also includes how do we consider the risk involved with any treatment? And this is more of an ethical question. We are changing, we're managing, we're reducing behavior. We're dealing with human behavior. It's a very complex, difficult topic. Number one, as always, do no harm. Never do anything that's going to harm your clients. When we think about risk, we can have physical risk of physical harm, emotional risks. Think about restraint and punishment, how that might affect your client short and long term. And then what about socially? What is the social risk of, let's say, helping a child at school and having his peers observe this? You've got to consider these three factors and what we're doing and how they're impacting your child. There's a big criticism of ABA that we don't consider these ideas, and it's just not true. We have to consider the emotional response and the emotional effect. We've got to consider the physical response and the physical effect. And then social is so important, especially when working with, let's say, children in a school or group environment. And then what about your constraints of treatment? This kind of goes hand in hand with the environment. Do you have enough time to implement? Do you have the resources? What about the money? Is it legal? Are there ethical considerations? You've got to consider these things before you tell your team to go do it. Because remember, in most cases, you're going to be writing and designing interventions and training but it's going to be on your technicians to implement them. And if you're not setting them up for success because they don't have time, they don't have the resources, and that's going to be on you when things don't go as planned. If you don't think the intervention is sustainable long term, you may want to think twice about using it. It might be great for 1 or 2 weeks, and then you figure out, well, we can't do this for 6 months. It's not possible. It's probably time to move on and try something else. Finally, social validity. We talk about social validity all the time. What we do needs to be meaningful. Behavior change should have a purpose. It should affect lives in a meaningful way. Ask yourself, is the behavior change meaningful to the client, the stakeholder, or the community? If they aren't, then you really want to think about, should I even be worried about this? Is this worth our time? Our time is valuable, it's limited. Pick the best options. And then, will the intervention change the behavior in a way that is meaningful? Meaning, what's your goal? Is your goal a small change, a large change? That's going to depend on current levels, on developmental levels, on time. You've got to decide that up front. Well, what is my goal? What does a meaningful change mean to me? What does it mean to my client? So that's H3, a little more deep of a deeper topic because it's going to be much more along the lines of, let's say, your moral compass and your emotional intelligence. We are guided by science and data. That's what drives us. When we encounter something like H3, though, and when we get to the new task list, it's a lot more of this kind of thing where it's not just about being robotic and data nerds. We've got to consider the human aspect of everything we're doing, preferences, environments, what are the risks, what are our constraints, and is it meaningful? As always, please like and subscribe. Subscribe for all of our video updates. Check out behavioranalyststudy.com for all study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.